Manolis Kojevinas, I'm head of the cancer program at the Barcelona Institute for Global Health. It's been nearly 25 years that I'm working in epidemiology, so I have done many things in my life. I think among the most important ones that made a difference is the work that I did on dioxins with workers producing or spraying phenoxy herbicides when I was still at IARC. Dioxins is a big issue, and I think the big cohort studies we did contributed together with other evidence in classifying dioxins as human carcinogens and regulating them. So that was important. Another area that has made a difference is the work we did on occupational asthma, where we found and we reported the association of exposure to irritants, exposure of cleaning women mostly, with occupational asthma. My main goal, general goal, is to do research that matters. And I'm working a lot on both environmental and occupational causes of cancer and respiratory diseases. And I participate in some of the studies on child health also, actually. So I'm working a lot nowadays on circadian disruption and shift work, which is a very big issue. We didn't know it was as important. It affects a lot of people, and it affects major diseases like breast cancer, cardiovascular diseases, obesity, diabetes. In relation to shift work and breast cancer, we find an increase, and prostate cancer we find an increase, stomach cancer we find an increase. So it is a much more general effect. And we also have been working on mechanisms. How could this be produced? And we identify, again, more general effects. It's not only melatonin, as some people think. It's much more general, the effects of changes in due to circadian disruption affecting the hormonal system, for example, more generally. We have changes in hormones like progestogens or androgens. The connection to some of the hormone-related cancers is nearly obvious. So prostate cancer, yeah, we could see a connection there.